Emergent surgical consultation should be obtained in a patient with GI bleeding and which of the following? A. Esophageal varices. B. History of abdominal aortic graft. C. Initial systolic blood pressure 100 mmHg. D. Liver disease. E. Transfusion requiring 4 units of blood. Answer is B. History of abdominal aortic graft. Emergent surgical consultation is needed for patients who have abdominal aortic grafts and who present to the emergency department with GI bleeding because of the possibility of an aortoenteric fistula. Consultation with a surgeon should be obtained if it appears that more than 5 units of blood is required to achieve hemodynamic stability or if there is reasonable suspicion that operative intervention may be needed. This is especially true for patients older than 65 years. Patients with a history of varices, persistent postural changes in heart rate, or significant bright red blood per rectum are more likely to require surgery than patients without these findings. What is the most common type of diarrhea seen in emergency departments? It's A. Dysenteric diarrhea. B. Inflammatory diarrhea. C. Invasive diarrhea. D. Osmotic diarrhea. E. Secretory diarrhea. Answer is E. Secretory diarrhea. Diarrhea results from one or more of 4 different pathologic processes that are characteristic of the primary cause and contribute to the decreased absorption in the gut. Secretory diarrhea is caused by pathogens that produce cytotoxins that increase cellular permeability and cause the oversecretion of water and electrolytes. Non-infectious causes of secretory diarrhea include medications, toxic substances, endocrine disorders, and neoplasias. Most cases of diarrhea encountered in the ED are secretory. Inflammatory diarrhea, also described as invasive diarrhea or dysentery, results from cellular damage to the intestinal mucosa, leading to the secretion of water, electrolytes, blood, mucus, and plasma proteins. Osmotic diarrhea occurs with the ingestion or malabsorption of osmotically active solutes. These solutes cause the osmotic shift of water into the intestinal lumen to the extent of overwhelming the gut's ability to reabsorb it. Abnormal motility is generally seen in patients with chronic diarrhea but is always a component of acute diarrhea. Hypermotility decreases contact time between luminal contents and the absorbed ing mucosa, thereby limiting water and electrolyte absorption. An otherwise healthy 25-year-old man presents with a 3-day history of diarrhea. He reports associated anorexia, weight loss, shortness of breath, and itching. On physical examination, he is noted to have diffuse erythematous wheals on his skin, and pulmonary examination reveals bilateral wheezing. Of the following, which is the most likely cause of his diarrhea? A. Bacillus cereus. B. Enteric adenovirus. C. Giardia lamblia. D. Rotavirus. E. Vibrio vulnificus. Answer is C. Giardia lamblia. Hives and bronchospasm in this patient point to excessive histamine release. In the setting of diarrhea, histamine release would most likely result from a parasitic infection. This is not common, however, it should be considered in patients presenting with diarrhea and histamine-induced skin changes. Of the choices listed, Giardia lamblia is the only parasite. Evaluation of stool for ova and parasites would prove least beneficial in which of the following subsets of patients presenting with diarrhea? A. Patients concurrently taking clindamycin. B. Patients returning from a trip to Russia. C. Patients with chronic diarrhea. D. Patients with human immunodeficiency virus, HIV. Infection. E. Patients working in daycare centers. Answer is A. Patients concurrently taking clindamycin. The assessment of stool for ova and parasites is not routinely recommended in most cases of diarrheal illness. This study is used in patients with chronic diarrhea, Entamoeba histolytica and Cryptosporidium patients with a history of travel to developing countries, particularly to Nepal or areas of Russia, Cryptosporidium, Giardia, and Cyclospora, patients with exposure to infants in daycare centers, Cryptosporidium and Giardia, and patients with HIV infection, E. histolytica and Giardia. Patients with diarrhea who are concurrently taking clindamycin would benefit most from testing for Clostridium difficile toxin. Which of the following antibiotics is recommended for the empirical treatment of systemically ill-appearing adults with diarrhea? A. Azithromycin. B. Ciprofloxacin. C. Metronidazole. D. Trimethoprim sulfamethoxazole. E. Vancomycin. Answer is B. Ciprofloxacin. The current recommendation for empirical treatment of a systemically ill-appearing adult is ciprofloxacin 500 mg orally twice a day or levofloxacin 500 mg orally every 24 hours for 3 to 5 days. Fluoroquinolones are efficacious against most organisms that cause dysenteric illnesses and have been shown to be more effective than trimethoprim sulfamethoxazole. Fluoroquinolones should not be administered to pregnant patients or children younger than 18 years old. Which of the following causes of diarrhea is more common among children who attend daycare than among those who do not? A. Campylobacter. B. Escherichia coli. C. Salmonella. D. Shigella. E. Yersinia. Answer is D. Shigella. Daycare attendance increases the probability of a patient having non-benign diarrhea caused by Shigella, Giardia, or rotavirus.